The latest data from the Canadian Institutes of Health Research shows about 12% of high school students in this country are vaping daily, and some say that number is low. All the while, public health officials across Canada are calling on the federal government to ban vaping flavors. The Centre for Addiction and Mental Health offers free and confidential treatment to youth in Ontario. And joining us with more information is Dr. Peter Selby, a senior scientist, senior medical consultant, and principal investigator of the Intrepid lab at CAMH. Dr. Selby, good morning.
Good morning.
Tell us about the Youth VAST program and how it works.
So Youth VAST essentially is a program which stands for Vaping, Alcohol, Substance Use, and Technology Use. And this is targeted to school-aged children right from ages 9 to 21, anywhere in Ontario. And the way it works is people can either call or email or go to our website and log in and essentially request an appointment, fill out a few questions to just get a sense of what is going on. And one of our care coaches will call them, really speak with them, understand either themselves or their family or both, what kind of problems that they're struggling with, who they've already seen, what services they're already getting, and then think about where their motivation lies to actually get help. And then they can get connected to one of our 3 programs for vaping or for substance use and or for gaming, or all 3 as needed. And then we'll see a physician if needed, or we'll see the counselor and therapist. And then the care coach essentially stays in touch with the person regularly, weekly mostly, to see how things are progressing, what's the struggles they're facing, help them get motivated, and really adapt the treatment to young people wherever they might be living in Ontario.
This is Canada's first personalized youth addiction program. Are you seeing results?
Well, it's too early to say because we just started off from scratch last year as we saw this gap in the system where, yes, we have youth wellness hubs which are excellent and are scaling up across the province. We saw and very specialized services, but you had nothing in between where people's motivations were not ready, or there were other barriers, or they were getting partial treatment. And so, yes, this is that first of its kind. So it's done its first year, well, not really a full year, but really has started out getting people in. We did the soft launch in January. We've had young people and their families through. And of course, we keep iterating and are now ready for more as we go forward, because we know the job's not done.
Dr. Selby, we got a minute. Do we know the health impacts of vaping at this point, at least the full health impacts?
Well, we don't know the full health impacts in the long term. And that's, even though vaping might be a good option for, inveterate people who smoke, who cannot stop, for young people, the biggest concern is the exposure to their lungs and, of course, getting addicted to vaping. So, yes, we know that people can get addicted because most people who vape are vaping, or young people are vaping with nicotine. And when you inhale nicotine that way, it'll make it addictive.
Dr. Selby, thank you so much for your time this morning. Best of luck with the program. I'm sure we'll see some results very soon.
Thank you very much for having us.
That was Dr. Peter Selby from CAMH. More details on how you can connect with the program on our website, chch.com/morninglive.